Welcome to Something to Talk About. Today we're going to talk about COVID and vaccines and masks with Neil Baker, who is the holder of an MD degree. But what he's going to be talking about more today, I think, is about social interaction and the social aspects of moving forward in a time where part of the population is vaccinated, part of the population is not. And we have this pesky issue of variants of COVID vaccines, which are starting to make their way around our world. So unfortunately, the choices that we've had to make over the last year are not behind us. So that's the topic of our discussion today. And I appreciate you all being here, and I look forward to you participating with your experiences and thoughts about the best way forward for you and your family, because we're starting to see a lot of people get involved. Before we get too involved in the discussion, though, I want to remind you that the Senior Center is open to everyone. Our goal here at the Senior Center is to make sure that people have the opportunity to live in a community where you can age with mastery. And we do that in a lot of ways, both through exercise programs and conversations like this, and being a go-to source for information and assistance. We're about to begin. In fact, we just started yesterday a spring campaign to raise money for the Senior Center. You can find out more about it on our donate page. Neil, thank you very much for joining us.
Hello, can you hear me?
Yeah. So I know that you have been doing a little investigation as you have been throughout the COVID crisis at sort of how things are shaping up. And although there's a lot of optimism, at least based on some of the comments you sent me this morning, some of that optimism may be a little ahead of the ball. Can you give us sort of an update of your read of the situation?
Sure. So just to be clear, I'm not on this call as an expert of any kind in this. And I'm just a citizen trying to figure out how to keep myself and my loved ones safe and trying to follow the recommendations. And so I'm interested in any disagreements, different point of view, additional information. I will say I do have a special interest in trying to understand medical research. I was an MD, but not in the area of public health, epidemiology, or infectious disease. But I was responsible for reviewing the quality of research for evidence-based guidelines for group health when it was group health. And so I have an interest in understanding things from that perspective. How strong or weak is the evidence, and also have an interest in figuring out how to assess risk for oneself and for family members. So I'm not an expert, but I have had a special interest in that. When the epidemic started, I did try to follow the original research for about an hour. And I'll tell you, I couldn't understand it. I think this is a unique area of research. I think you have to be an epidemiologist. So over the course of the last year, I ended up following about 8 or 9 different epidemiologists on Twitter. And if I'd see an article come up, I stopped studying in depth in areas a long time ago. I also stopped looking at the inevitable articles like masks are worthless and chasing those things down. Because if I go back to these 7 or 8 different infectious disease epidemiology sources, they were all saying very similar things or acknowledging the uncertainties and disagreements between them, and it was clear where they were. So that's what I've done. And then
we certainly had instances where normal differences in opinion, especially in an emerging situation, got used politically or socially to make it look like there was more division than there was. Early on, right. I feel as though we had an attack of the tobacco company lawyers, where they kind of tried to say, well, the evidence is not all in. And you're saying that pretty soon it became clear that there were some there was some consensus, even if there wasn't like an airtight case.
Yes. The other thing I found is that you're not going to find definitive. If somebody's saying a study's definitive, it's just not the case. I mean, I've talked with people who say there's research that wearing 2 masks isn't worthwhile, and things like that. And and in the coronavirus, what I'm gathering from the epidemiologists who've studied pandemics over the history of the world and humanity is that the coronavirus, like Michael Osterholm, I really respect because he tells the truth and it says where he's uncertain. He's an epidemiologist, the head of the Center of Infectious Disease Research and Policy at University of Minnesota. He has podcasts every week, and I'll mention one of them today. And basically, he says, I don't know what's going to happen next. This is unlike any other pandemic I've seen or read about. And the other characteristic of the pandemic is that we don't know exactly what controls it. But those 7 or 8 people generally agree that in this uncertainty, social distancing, masks, bubbles, they agree on the basic series of things that are needed. Testing, contact tracing, which incidentally we've never had. And so I've come to the opinion that one of the reasons things are particularly problematic in the US is people can travel between states, and some states are locked down. In some states, some cities are locked down, some are not. And it doesn't matter. If people can travel between them, it becomes a giant mess of coronavirus, which is what we've got. That being said, there are some variations which still seem worth understanding. So my wife and I kept in a very strict bubble between ourselves up until things started coming down in the summer. Then my philosophy was, if we're going to be in a bubble, we need to talk to everybody in the bubble about how they manage it. Because in our society, I suspect in most places, we aren't used to talking about behavioral specifics. And when we do, it can feel judgmental. For example, if I ask, so I socially distance. So I say, well, what does that mean? I mean, you go inside with people, with or without masks, and starting to get the details, things start to get clear, and people say, oh, I was inside for 20 minutes. It was no big deal. And so the approach I took at that time, and my wife and I took, is there's no judgment. We each have our own risks assessment. You could be fine with indoors, with or without masks. That's fine. All I care about is assessing the risk for myself and my wife, and then letting other people know what the best information I have is about the level of risk. So when we had these conversations, it felt awkward, and I'm very used. My career has been in dealing with sensitive conversations, and I found that it was not easy. But we developed 2 bubbles, one with my wife's daughter and husband and grandchildren, and one with my son in Seattle, there on the island, one with my son and his wife and grandchildren. Interestingly enough, there were one bubble had 6 people in it, and the other bubble had 4 people in it. And we felt we needed to talk with all those people. And I found that people were just varied in their strictness with this, and we made judgment calls about it. And in one bubble, they were comfortable with us being immediately in their bubble after being in the other family's bubble. The other family wasn't. We want 2 weeks between bubbles. So it gets very complicated. And I found, frankly, even though I'm good at such conversations, I found it's hard work. I don't fault people I just think it's hard to have those conversations. So when
I know in my family, my daughter had a baby during this pandemic, and her sister-in-law, who has been living in a completely different sort of situation in Chelan, and has felt very safe in their community, has been frustrated by the fact that my daughter and her husband have been very protective. And it gets emotional when the guidelines theoretically are are just a judgment call between the various people.
Yeah. And for me, that's difficult. Probably one of the reasons I've done a lot of study and made dealing with conflicted conversations part of my career is I'm very sensitive. I'm a people pleaser. I want to please people, but I also find it very hard to go against my gut feeling of the truth. So that presents a big conflict for me. And so when the latest surge happened in the autumn and winter, I'm going, oh God, I don't want to do these conversations again. Oh, there's no way. And you know what I decided? I'm not doing it. My wife and I decided we're staying strictly in our own bubble. It's too complicated. It's too risky out there. It's a COVID soup. So that felt okay. And there's prices to pay. Other people, the grandparents and other grandparents in both bubbles were seeing the kids. So it was painful. It was difficult. Now I've gotten my second shot of Moderna, and my wife's getting her second shot Sunday. And already grandkids are saying, when do we come over? When do we come over? And I've been saying, I don't know. We're studying it, and we'll see where the epidemic is. So we've got a couple of weeks to sort out what are we going to do. So that's what I've been thinking about. And I still feel like there are some things unknown. Michael Osterholm has a podcast yesterday in which he said, I'd love to tell you everything's okay. They called him Dr. Doom a year ago in March because there was only a handful of cases in the United States. And he said, we're going to have around 480,000 deaths. And there was a researcher at the Hoover Institution who called him delusional and used a calculation to show there'd be only 5,000 deaths. So, but he's basically saying, we're letting up people are letting up restrictions at the worst time. Europe is having a surge now of the B117 virus from the UK, which is more transmissible, significantly more, and also of great concern, more transmissible in kids. So we're opening up schools at a time when B117 from the United Kingdom could be coming in. And basically, if we just held down for a couple more weeks through this, we might be able out of the woods. And he said, we've still got 55% of the country which has not been infected, so has no antibodies, and hasn't been vaccinated, and 17 million elderly haven't been vaccinated, and no kids have, and we got the variant coming in. So again, I'm not telling you what you should believe. This is what I believe, and I believe that's a risk that gets taken into account. Incidentally, of interest is that those bodies I have a friend who said, we have a caregiver come in, her husband has heart failure and stuff, and they wear masks and are fully vaccinated. Do we have to wear masks? We're fully vaccinated. So in researching this, let me tell you what the CDC says. You can gather indoors with fully vaccinated people without wearing a mask. So I could have told her, oh, no need to wear masks. Well, maybe I should look at for some reason, I was a little worried about variants. So I looked at the Washington Department of Health website, and it says, because COVID variants may spread more easy, it is vital that we all follow the social distancing guidelines. Wear a well-made, well-fitting mask, even with people you see regularly and in your smallest social circles. That's not the same to me as the CDC recommendation. So I told my friend, again, I have to keep in mind avoiding asserting a strong opinion as though it's the truth. That's my main principle. And leaving room for other people to have their truth. So I said, I don't know the right answer. Some people, like the CDC, would say, fine, don't wear a mask. But I'll tell you, in my shoes, I'm very conservative. Your husband is at high risk because he's elderly and has heart failure. And even if the vaccine makes it less likely he's going to be hospitalized or die, there's long-term COVID and other things to consider. And I might wear a mask. I'd probably wear a mask if I were you, even with these caregivers. At the same time, another perspective, you could call the caregivers and ask them, or your primary care physician, frankly, I was anxious about getting the vaccine. I studied it all. I had to write my primary care doctor and ask, did you get this? And he said, yes. So I got it. So
it went down to I trust
ultimately,
you.
While I had to read the science myself, or these experts myself, it came down to I had to talk to somebody I trusted. And I don't know what we're going to do 2 weeks after in 2 weeks, when we're both fully vaccinated. I think we've been careful to prepare people for not being sure. And I'm interested in your views. I'm not sure what we'll do. I think it also depends on who knows where the state of the coronavirus is going to be. And, especially with schools opening on the island and the CDC recommending go down to 3 feet, in which Michael Osterholm said, well, this could be okay with the strain of virus we've been working with, but it ain't going to be okay with B117. And so I'll stop here.
Okay.
I struggle with this. I'm interested in your thoughts about it and pros and cons. I think it's a sensitive emotional issue. It really has been, I'm much happier just locking down, but I'm also not happy if I don't really consider all the issues. So I'm going to have to gear myself up to open myself to all possibilities again in 2 weeks or over the next 2 weeks.
Yeah. So I will invite anybody who has a comment to raise your hand, and we'll call on you. I know Sheila has done that. I'm going to just say one comment before that, which is that at the senior center, we have been working on this same issue because with a number of people who are vaccinated, we are starting to look at how we can allow people to participate in programs in person in a way that is safe. And as Neil is pointing out here, it's not a cut and dried, simple issue. So, Sheila, did you have something to say? Karen King. Karen, go ahead.
Hi, Neil. I too am very conservative. I have a autoimmune problem and leukemia. So I was actually very careful even before. My oncologist told me last February, I believe, that she said the death rate had skyrocketed from this weird pneumonia. And she said, and of course she was telling all of her patients that, she was telling them long before to be careful. And I just have been, basically hunkered down for about a year now, and get out and take walks but still not amassing with much people at all. Also, I read this past 2 days is that 27 states, the caseloads in COVID-19 infections have gone up in 27 states. That's very discouraging to me, and it's starting to creep back up in our own county and in King County. So I just wanted to let you know that I too am very conservative like you.
So have you thought a little bit about what you're going to do given that conservatism after, you said you were going to get your second vaccine in a week, less than that, and then it'll be 2 weeks after that. You're going to wait and see where you are, where the country is at that point, or where the county is?
Exactly. I'm going to, I keep an eye on the county numbers every day. My doctor is always in contact with me about what she feels. And of course, she is very much, very conservative also, especially with her patients. So, so I'm probably not going to do much because I see this trajectory going up again in infections. And so I'm probably going to just play it cool like I have been for a year now. So.
Yeah, it is interesting. The choir I'm involved with is going to get together tomorrow night to sing. And it's like, well, that's, is that a little premature? Sheila, you have your hand up again.
Yeah, I think that might be a little premature as far as the choir goes. I just heard, well, all right, so this is what I hear from the people over at the Mariners, because they're starting the Mariners up on the 1st of April, April Fool's Day. And the two doctors that were on there, one was Neil Gupta, and the other gal was Kathy, and I don't know her last name. Anyway, they talked about what needed to be done and the protocol for the Mariners, and that was double masking. They're providing the masks for us. And they also said that with the variant, that if you've been vaccinated, the variants were taken care of with the vaccination. That there's not a problem as far as with the variants, because that the vaccine that we've gotten covers those as well. So that's what they're besides a lot of other stuff, information, but basically that's what I took away from it.
Any thoughts on that, Neil?
Yeah, what about that, Dr. Baker?
You have to unmute yourself, please.
I apologize. Could you state again the question?
What she was saying was that that the variants, she was advised by the folks from the Mariners and Dr. Gupta, who's going to help them out with trying to figure out how to restart Mariners games beginning on April 1st, that the vaccines that we have been given have so far been significantly effective against the variants that have arisen. In your reading, is that essentially what you've seen as well?
I haven't studied that piece. I've heard they are. I'll just have my personal reaction to statements like that, because I'm pretty conservative, is significantly is in the eye of the beholder. In medicine, it gets very tricky about when people quote, for example, a vaccine is 79% effective. That does not mean what you think it means, that it prevents 79% of the time you won't get the illness. So when I look across, and I haven't looked across these various epidemiologists, what they said about this, it seems like a productive, but I haven't glanced at, I haven't seen on Twitter other things them saying how great this is against those, but they could be. So my sum is, I can't comment on it, but I was facing that I'd probably look at some other sources, and I can give you some if I'd like. And I personally would still stay pretty conservative. That would be my personal thing. But I wouldn't fault anyone based, that's my way. But some people would just take that and go to the games. That's fine. If they feel they can do that. So
and so there's one of the things to note about how effective a vaccine is. You mentioned that it's not that 95% of the time you won't get it. It's also in a certain testing period in certain conditions. So the vaccines that most of us have received to date, Pfizer and Moderna, were tested before the variants arose. Right. So our only real judgment about them is the response to the variants in the field. And obviously, that's still an unknown. So, or at least the data is incomplete. So we could say inconclusive. Anyone else have a comment about how you're thinking about what you're going to do, or your family? We'd love to just have you pop open your microphone. John Perkins. You need to unmute yourself. There's a little button at the bottom that, there you go.
So I've had, my wife and I have had two vaccines, and it's been a number of weeks. And my daughter and her husband have had two vaccines in weeks, and we've known several other couples, and we feel very comfortable getting together with them. I mean, life's short. It's getting shorter every day. If you can go through you know, I was not one of these people that every time I went to the grocery store, I wore plastic gloves. I was, you know, who was that J. Paul Getty or whoever it was. I mean, you know, we people can get very fanatical about
Howard Hughes, I think, is who you're
Howard
thinking.
Hughes, that's right. You know, the whole thing, I think we've become very, very fanatical, and I'm very conservative too. I travel a lot to Latin America. I'm very cautious. I only eat cooked foods. I don't drink these beautiful juices and fruits that they have, and so on. I'm very cautious, but I also think that we can go a little bit overboard with this. So if you're going to get the vaccine and you know other people have gotten it, my attitude is if I'm going to go that route, then I want to see my daughter. I want to see my grandson. I want to live too. And I think there's something to be said for looking at this as a whole life experience. Life is not just about not getting the virus. That's certainly important. But I think, you know, 76% or 95%, which is Moderna, I think, which is what I had. That's pretty good statistics. That's probably better than, you know, I'm going to leave here pretty soon and get in my car and drive someplace. And I don't know what the statistics are that I'm going to have a car crash, but they may be as high as the statistics around the vaccine. I'm not sure about that, but I think
I get your point exactly, that we do deal with a lot of risks in life, and some of them, this one is obviously of high importance. The fact that it is such a transmittable disease and that sometimes the effects can be fatal is not to be underestimated, but especially when you start to add things like vaccination into the picture, it gets a little more complex. One of the things that we're talking about at the center is only allowing people here who have had the vaccine and had a period afterwards so they can develop an immunity, and then even then requiring them to wear masks, so that there's some further impediment to transmission, and limiting the number of people in classes, especially things like line dance or exercise classes, and employing HEPA filters, which we did not have here a year ago. So putting all those things together, none of them on their own or even in concert are going to be foolproof. But I get your point, John, exactly about the idea of a balance. And I certainly understand if somebody, even with those protections, would not feel like it was right for them to participate in person. So we're going to try to keep activities like this going on online as much as possible. Anyone else thought about this or talked about it? I'd love to let everybody have a chance to speak up if you're mulling what's going to be the right answer for you. Lawrence?
Yes, my wife and I both have our shots. We did them Moderna, but whenever we leave the house or the apartment, we continue to wear masks, continue to wash our hands when we come inside. So we're still taking the precautions, but we feel a little better with the shots, but still not 100% safe. So we're still using and living with the precautions.
Well, you know, on the other hand, Lawrence, we've been being told to wash our hands and be careful about how we sneeze for years. We just haven't paid attention to that.
Yes, that's true. That's true.
Neil, any comments at this point?
No, but considering what John said, Michael Osterholm, the epidemiologist I mentioned, was asked on a podcast what he would do, how he'd change things if vaccinated. And it was interesting that he wasn't sure, but he thought of one circumstance that he would do. And he said the same thing as you. If I and my wife are fully vaccinated and I have some adult friends we will get together. And there's still some increased risk, but it's worth it because life is short. So I would do that too. I think the question for me is, with grandkids who are at school, to me, I would have to look at the prevalence of variants in the community. If the variants weren't prevalent, I might go ahead. So, but I haven't worked fully to taking that step yet.
And the idea of some precautions. Now, the kids who are going back and forth to school, that's a very interesting situation. because especially if a variant is in the community that might be affecting school kids. John, you're back on.
Yeah, I actually needed to clarify that. When my grandson is involved, we wear masks. So my daughter and her husband came over the other night to our house and had dinner, and we sat inside for the first time. And actually, those were two friends, and it wasn't my daughter. And it was two good friends who'd been vaccinated, been over 2 weeks since their second vaccination. We sat inside without masks. But when I get together with my grandson, and sometimes I'm called upon to take him to some event. He's been playing lacrosse with just with a few friends that have all been very careful. But he wears a mask in the car. I wear a mask. He sits on the back seat, and we have all the windows open. So yeah, I think that Neil, in response to you, it's particularly when we're around kids, it's very important to be cautious.
Hey, John, that's really helpful detail. Thank you. That helps me in thinking ahead. I was curious how old your grandson is.
He's 13.
Okay, so that's interesting because it's even anyhow. Well, with the variants, the suspicion is that kids at any age can be spreading it. So, but with this strain we've had, it's more the younger kids. But that's extremely helpful detail. Thank you.
The other thing that I think about with my 14-year-old grandson is that he will see his family win. He is in two households, divorce situation, a brief quarantine and a COVID test. And I'm a little concerned that some of like I noticed the city of Bainbridge Island is stopping its public COVID testing at the end of the month. With the vaccine being administered, I'm concerned that we're losing the enthusiasm around regular testing. And that would help us a lot, wouldn't it? Wouldn't it, Neil?
Well, that's my reading from everybody. And you notice you don't hear much. I don't hear much about testing from these days, but there is one epidemiologist I follow who's quite outspoken on this, who says that, look, a lot of the problems we're facing is because we do not have a healthy public health infrastructure. And an example she gave is that because our public health infrastructure is not geared up to do testing and contact tracing, in the United States, when we try to study, is there spread in schools, instead of a reliable approach which uses testing and contact tracing, we just have to ask people, and that's pretty unreliable. So people don't talk about that much, but I tend to agree with her, and I think that it's helpful to me at times to remember a lot of the hoops and confusion has to do with that, is that we just don't have the strongest infrastructure.
I want to mention that the Bainbridge Island School District does offer testing to people who are involved in the district. So that is an option for people who are starting to go back to school and involved in, and of course, we in this state have, as with other states, been vaccinating teachers, which is a good idea since they're starting to get back together again. I'm not sure who's on the phone. The last couple digits are 49, but if you have a comment you want to make, all you have to do is press *6, and then your phone will be open and you can ask your question or share a comment about what you're doing about thinking about reopening of our culture with COVID vaccines. Jim Hayner. You'll need to unmute yourself, and then we'd love to hear what you have to say. So just press, there you go, right? Press the unmute button. Press the little microphone button in the bottom of your screen there, Jim, and we'll hear you. There you go.
I'm sorry. How do you get tested? I mean, if they're going to close the city testing thing down, how do you get tested?
Well, I know that you can, if you have a primary care physician or a doctor in the region, you can usually approach them. I have twice been tested through Kaiser Permanente, and I've just called them and explained why it was that I was looking for a test, and the doctor approved it. And so then I went to a drive-through testing in Silverdale, and I'm sure that that's also true at a lot of maybe Virginia Mason, whatever it's called now, Franciscan Mason, and it's also true that you can get a paid vaccine or paid test rather at a lot of pharmacies. And so you can look that up, and I'll share in a link to this video information about where you can get COVID tests. But they're still available. You may have to pay for them.
Right, not a problem. While I'm unmuted and I see Bonnie arriving here, I want to thank you, Bonnie and Lawrence, for that wonderful card that you sent. And I appreciate it. If I were anywhere near as creative as you, I'd do it. I'd write it myself. So thank you so much, and thank you for your good work here, Neil. Sounds awfully good.
Any other comments or remarks about sort of where we are, where you are, what you're thinking about as we move into what's sort of the next? I mean, it's definitely a next phase. We're phase 3 in Washington State, which means that there will be greater invitations to show up at restaurants or participate in public events. As I said, at the senior center or elsewhere, there'll be more activities. So it's going to be an ongoing conversation, and I think that obviously the risks are not behind us, and the next few months are going to be telling by all means.
I have a real quick,
Sheila, yes.
Neil, I have a real quick question for you. As I understand it, if a person has had COVID, I have a friend who had COVID, was in the hospital for a couple of weeks, was not intubated, but he was in for 2 weeks, recovered to a point. And that was back in January when that happened. In fact, he had it twice, and he was in the hospital twice with it. And he's also had he's had the vaccines, both of them. Now he seems to think that he's pretty safe. What do you think?
Let's see. I would say that if I were in his shoes, I can't speak to what his whole context because I don't know it. But if I were in his shoes and somebody said I was pretty safe, I would say, well, let me look into this. And I have not looked into that in depth, but I've done scattered reading. So I'll just tell you how personally I would be. I'm processing this right now with, again, I haven't researched this in depth. But I would say the scattered reading I've done is that it does look like that if you've had COVID, it confers some degree of immunity for a period of time. I had the impression it was up to 9 months or a little longer than that. I couldn't get from that how much immunity. So I don't know what pretty safe would mean. I've also so I personally hear that and I go, well, I'd be cautious and read more and talk to a few more doctors before I assumed it was pretty safe. I did have an experience with a friend who had a relative who was taking care of their kids, but was unmasked and outside. And one day this person went into the house without a mask, and they said, "What's going on?" And this person said, "I got COVID, I have antibodies, and that keeps me safe." Well, I did a little reading that showed that's not clear. And so again, it's, you can see how widely people vary in their response to outside data and stuff. And so knowing that, I'm kind of cautious.
Yeah, I do. I have heard that as well. The idea that having COVID may not be as effective in generating antibodies as some of these vaccines have proven to be. And again, even there, the vaccines are not. I mean, they're vaccines. They're not. The viruses are still out there, and getting sick, depending on your physical state, has a lot to, if you already have comorbidities, you don't have to get really sick to have, from something to have a secondary effect from it that then knocks you out or knocks you off. Jim.
But could I say one thing about that first? That John brought this up, is that we are constantly faced with living life the way we want to and the level of risk. And one thing that helped me, like when we opened up our bubbles with our grandkids in the summer, I did it knowing we're taking some risk here, but I'm willing to take that extra risk. But it didn't mean I wanted to get the coronavirus. I never want to get it, even with protection from hospitalization. On the other hand, like John said, I'm going to weigh that against some other personal interest.
Does anybody know where you can get Johnson & Johnson?
There was a clinic in Paulsbo that was doing it. I received a message.
Bainbridge Prepares has been working with Bainbridge Island Community Pharmacy, and they're doing mobile clinics using Johnson & Johnson, mostly to locations like group living around the county. They've been using Pfizer in the mass clinics at Commodore. I think that there's some Johnson & Johnson being administered by the Kitsap Public Health District, and you can find them online as well. One of the things that's interesting about that is that the Johnson & Johnson efficacy tests were done after some variants were in the field. And so although their sort of efficiency number or effectiveness number is lower than Pfizer, that you have to kind of consider that they were being tested in areas where Pfizer wasn't being tested. It was later. It was a later period. But yes, and I think that that's a wonderful thing to have a single dose vaccine out there. When we look at, what did you say, Neil? Half the population of the country has not been vaccinated yet?
No, what Michael Ostrom said is that 55% of the population has either not been vaccinated or had the illness, meaning they don't have antibodies. So that's two groups.
Okay, but having
so 45% of people have some immunity based on vaccination or having had the illness.
Got it. Well, I want to thank you very much for sharing your scattered reading, your informed thinking, and helping us to think for ourselves about this, because it's challenging, and we look forward to having you come back again sometime.
I do too. And incidentally, I want to thank all of you for your questions and examples, because it makes me think about it. It helps me in processing it. So much appreciated.